Hello friends, welcome to Adrenaline. Today's topic of discussion is deglutition. The main questions from deglutition are stages of deglutition, associated disturbance, deglutition reflex. And among this, among the stages, the main stage of deglutition, it's the second phase and it is of most importance. Now let us go to the topic. First of all, about the definition, deglutition is the process by which food material travels from oral cavity and it is transported into the esophagus. This process is called deglutition. It occurs in three phases and they are oral phase, pharyngeal phase and esophageal phase. Now let us look into each phase separately. First, about the oral phase. The oral phase is a voluntary phase which is less than 0.3 seconds. The tongue pushes the food bolus to the back of the mouth. From there, it is transported to the pharynx in the pharyngeal phase. Pharyngeal phase is an involuntary phase which is less than 2 seconds. In pharyngeal phase, passage of bolus from pharynx to esophagus takes place and through a reflex process which is called swallowing reflex. The swallowing reflex is the most important question from this topic. Now, let's discuss about the swallowing reflex. For the swallowing reflex, the receptor is present around the pharyngeal opening. The afferent is the trigeminal nerve, glossopharyngeal nerve, vagus nerve, and the center in the brain is the nucleus tractus solitarius and nucleus ambiguus in medulla. And now about the efferents, they are muscles of the pharynx supplied via the trigeminal, glossopharyngeal, vagus and hypoglossal nerves. Now about the events during pharyngeal phase. The main events during the pharyngeal phase is to stop the passage of bolus to cavities other than the esophageal cavity. For this, first of all, the food should not be regurgitated back to the oral cavity, so the oral cavity should be shut off, and it is by the approximation of posterior failure of forces. Now, the food should not be regurgitated to the nasal cavity, and the nasal cavity is shut off by the upward movement of soft palate. Now, the larynx and airway is to be shut off. It is by the approximation of vocal cords. Now, here one important topic is the deglutition apnea. Deglutition apnea is the stopping of breathing temporarily when the vocal cord approximate during the pharyngeal phase. It is called deglutition apnea. The epiglottis sinks backward, esophagus is opened and muscles, larynx is pulled upward anteriorly by neck enlarging the opening of esophagus, and the upper esophageal sphincter opens up. These are the events during the pharyngeal phase. Now in the esophageal phase, the bolus is propelled from the upper part of the esophagus to the stomach. It is facilitated by the upper esophageal sphincter relaxation. Primary peristalsis is initiated below the upper esophageal sphincter. If the primary peristalsis is failed to move the food to the stomach, secondary peristalsis occur and it is initiated if the primary peristalsis failed. These are the main topics of the topic deglutition, and among this the main topic is the swallowing reflex and the pharyngeal phase. Now last, about the disorder of deglutition. Disorder of deglutition, the main topic to discuss is the impairment of abolition of deglutition reflex. It causes the nasal regurgitation. Tracheal or laryngeal aspiration of food may occur due to the abolition or impairment of deglutition reflex, and it is caused due to the paralysis of 9th and 10th nerve. Another important topics are achalasia cardia and gastroesophageal reflux disease GERD. Achalasia cardia. In achalasia cardia, lower esophageal sphincter failed to relax and the food is accumulated in the esophagus. In gastric esophageal reflux disease, there is incompetence of lower esophageal sphincter. This is all about the topic. Thank you.